Welcome to the Doctor Connect Show, the one-stop destination for the groundbreaking intersection of your passion and career. Join us for inspired conversations on how to combine your hobby and expertise or your career and create a lifelong fulfillment. This special episode I call The Invisible Heroes, where we unveil physicians' remarkable but yet unnoticed contributions. In a world where countless individuals work tirelessly in healthcare, it's time to spotlight those with boots on the ground and who makes a profound impact every single day. Despite the increasing number of women entering a surgical profession in the remain predominantly male-dominant field, but the gender imbalance isn't just limited to surgery, it extends to various other professions. According to Association of American Medical Colleges, only 22% of general surgeons and less than 6% of orthopedic surgeons being women. Today, our very special guest is Dr. Alexandra Kharazi. She is a board-certified cardiothoracic surgeon with more than 11 years of experience practicing in San Diego, California. She has done over 100 skydives. She is a mother and an author of the book, The Heart of Fear. She is a female surgeon who successfully navigated through high pressure in the health system. And now she is helping so many other people. And it is such a pleasure to introduce Dr. Kharazi because she also received multiple recognitions for patient satisfaction. And she has been featured in regional and national media outlets such as San Diego Union Tribune, Authority Magazine, Doximity, Sharp, Fox, and so many. Please welcome Dr. Alexandra Kharazi. Welcome, Dr. Kharazi, to our show.
Hi, Dr. Schaefer. Thank you so much for having me and for everything you do for the community.
I have been learning so much about you, and I can't wait to share it with the audience. Can you please tell a little bit about yourself?
In my 11 years of experience practicing medicine, I have become an author, speaker, CEO, and founder of Heart of Motivation Consulting. I'm a practicing cardiothoracic surgeon.
And I understand there's so many hats that you're wearing. You're boots on the ground, practicing surgeon. You an author of the book. Actually, I have read your book and was absolutely fascinated. So you speak, you do so many things and take care of the family. How does it work? Do female surgeons, especially specialized as you are, cardiothoracic surgeon, sometimes go unnoticed or maybe invisible?
There is definitely still a scarcity of female surgeons with only 22% of female surgeons in general surgery and 6% in orthopedics, for example. And I think that there's just different communication styles with female surgeons that often are come to the forefront. And so these can be studied and applied more widely to all surgeons and ultimately benefit patient care.
And the other professions, even stay-at-home moms, or let's say investors. Actually, I went recently to the conference and I noticed even not a lot of VC like investors are females. And occasionally discussing this issue can actually lead to intimidation. Have you encountered any form of intimidation in this uncommon occupation, such as many viewers might have? And what actions can we take to actually address this issue?
There's something that I call extract the benefit from error. So we can definitely learn from the experiences that other patients of female surgeons have, as well as female surgeons themselves. And we can apply them to then obtain better patient care. And for example, there's a lesser number of female surgeons on surgical advisory boards, and increasing these numbers of female surgeons and surgical advisory boards is like ascending the spiral staircase. So with every turn, we go to a higher or more advanced perspective.
So tell us a little bit more about the staircase. I really like that term, and it really resonates with me, because a lot of times we do things in life and we don't notice when we maybe go up or down. Can you explain what does it mean in your way?
Ascending the spiral staircase means that every time we fail, we actually get one step higher on the staircase. And every time we move up the staircase, we move to a higher and more advanced perspective. And so in this way, even though we're still experiencing struggles, and even though we're still working through a lot of these issues, we can ascend a rung higher every single time one of these issues occurs.
So I was reading your book, and it actually absolutely fascinated. The Heart of Fear, a surgeon's collection of stories on adversity, passion, and perseverance. Can you tell us what your experience when you interview experts? Have you noticed that there is some form of that staircase?
Absolutely. There is that form of staircase, and that permeates every single career. And this doesn't just involve cardiothoracic surgery. This permeates every occupation, and this includes even stay-at-home moms, for example, or people that are working for the tech industry. And when in interviewing these, I definitely found a common thread. And one of the threads that was found was the mindset coordinates. So that's figuring out exactly where you are and seeing where to go next from there. So it allows you to make a map of where to go.
If we apply to this map, and can we draw any connection in various roles, positions, or how actually we approach this? One thing that I learned, that research indicates that patients, for example, treated by female surgeons typically experience superior outcome. So what is the underlying factor responsible for this phenomenon? Or maybe what is the secret sauce here?
This is true, and the Wall Street Journal did recently come out with an article that highlighted these statistics, that people actually have more longevity and better outcomes when treated by a female surgeon. And I would urge people to think about how they communicate with a surgeon when that surgeon is male versus female. So are there things that you ask that are different? Are there things that you share that are different? For example, if a patient shares more with a female surgeon, then that contributes to more history and more workup preoperatively. And with more workup and more information preoperatively, that can lead to a better postoperative outcome.
This is very interesting, and a lot of this data actually have been hidden. And I think it's a lot of different, not only medical subspecialty, but different industry could resonate with this. And when I think from our homes to schools to work, women have always played a nurturing, teaching, and comforting role. But what happened when these women actually step into operating room and speak on communication? It's so much buzz that female surgeons may be more approachable. So then how we can educate the community when in this high stress situation, and being, for example, in emergency room, operating room, how can we actually communicate? Can you describe a little bit, maybe one of the examples that you had with one of your patients?
Yes, absolutely. And I think that this incorporates all of those things that we were talking about before. So people may feel more comfortable communicating certain things to female surgeons. Like, for example, one of the cases I had was a young boy that unfortunately had a cardiac arrest. And in the process, this was a very serious case, and we ended up initiating ECMO, and I was the surgeon that put him on ECMO, which is basically a heart-lung machine that supports the entire body, to hopefully see if there's any recovery of those organs. And the decision making was very sensitive in this case because he was very critically ill and all of those organs were failing. And the information that that family had gotten from the ER physician and from some of the other physicians that were on the team were just, he's not going to make it clinically. He's been dead. And it really took very a thorough communication with them, and them being able to share their concerns to create a care plan for him. So yes, there was that surgical component where we had to put him on ECMO, and we needed the surgical team for that. And sure, the technical part was all there, but ultimately once he was on bypass and getting him to recover and working with that family and working with him. And that was a large part of that recovery. And I think that part is often missing in medicine. We're often just told to take the emotion out of our work and to focus just on the cold, hard facts. We worship on this altar of cold, hard facts as physicians, but bringing our emotion into our work actually makes us better doctors and better surgeons.
Well, you just described the case and I had the goosebumps, because one thing that we are having conversation here and when we are listening, and another when you actually right there, and you are seeing life and death. So what is the exactly secret sauce? What is a delightful recipe for success in surgery and beyond? So what can you comment or maybe share, one experience in your situation?
So the secret sauce is, like you mentioned, it's going to be that empathy and that coordination. And I start with the mindset coordinates. So really knowing where you come from and being aware of your own bias. So mindset coordinates, knowing where we are. And so we could see where to go next, because it's not until we're fully aware of our own biases that we can then move past that, but not only that, but incorporate that and maybe even use it to help bring diversity to our work environment. And then secondly, it's extracting that benefit from AIR. Now that we know that we have data that female surgeons do have these better outcomes, how can we extrapolate that? How can we extend that to all surgeons? How can we climb and ascend that spiral staircase? And so then thirdly is something I call sorting through emotion. And once again, that just means that we are emotional by nature. And how can we integrate that into our work? And how can we integrate that to better connect with our patients? Because it's when we better connect with our patients that we can deliver more compassionate and good care.
Could you share some motivation for our viewers, especially those who feel unnoticed and overshadowed in their respective fields?
Motivation from intimidation is a perfect way to describe it. And this is where I would use a technique that I call flip your feelings. So this is basically taking a negative outcome or a negative feeling or a negative circumstance and flipping it and creating generating positive emotion and belief from this. Flipping your feelings essentially means, how can I make this serve me? How can I take this negative circumstance and flip it so that it serves me, and look at it in a way that it serves me, or act on it in a way that serves me? And so if we look at everything like that, if we look at every negative circumstance, experience as a form of growth, because growth is very uncomfortable. But if that's how we treat it and that's how we look at it, then it allows us to ascend along that spiral staircase and get to a higher perspective, even though in the moment it may feel like a setback, but it's about flipping that feeling and making that setback a tool for growth.
So I want you all audience, please connect with Dr. Kharazi, because she could actually navigate where in your specific situation you can apply this, as well as I really would like to, again, hug this book and address this book, because I believe that the heart of fear, a lot of us have not only fear for the disease, but we also have emotional fear. So flip the feeling. And this has absolutely been enlightening. And you are, as leader and helping others. I've heard a lot of stories when I read your book, how you actually elevate others and motivate others. You help others to be leaders rather than just, lead and then everybody follow me. So can you share the last, before we wrap up, something that you want to address with the audience?
Certainly, your journey is unique and so is your contribution. So celebrate your small wins. The world needs your talent and your voice. And I'm Dr. Kharazi, CEO and founder of Heart of Motivation Consulting. Thank you very much for having me.
Absolutely. And last thing, how is the audience can connect with you?
Sure. My website is www.alexkharazi.com. That's AlexKharazi.com. And you can connect with me on Instagram, Alexandra Kharazi, again, KHARAZIMD.
Wonderful. Dr. Kharazi, from the bottom of my heart, thank you so much for being on our show. Thank you for helping so many patients, peers, colleagues, and really take 360-degree, embrace the community, and help so many people. Thank you.
Thank you, Dr. Schaefer.
And our very special guest, Dr. Laura Fortner. She is a board-certified OBGYN, a founder of MedMal Coach Consulting, and she's helping in the community, including physicians, thriving through adverse events, malpractice, lawsuits, and trauma overall. And she has upcoming book coming up where she contributed in compilation of story from 15 physicians called Artificial Intelligence in Medicine. So Dr. Fortner helps in the community with stress, trauma, malpractice. She's a wealth of knowledge. So let's welcome Dr. Laura Fortner. Welcome, Dr. Laura. We are so excited to have you on our show today.
Thank you so much for having me. It's an honor. On my journey, I found and discovered that you can actually erase past hurts and traumas. I mean, once we thought that the brain worked in a way that we just had to manage these things, kind of get over them. They were still going to be there in the background, but you can actually get rid of them for good. Neuroscience has proved this. And in 1997, they discovered what's called memory reconsolidation. And it's a biological fact. And through my own past traumas and hurts myself, like we all get when we're human beings, I developed a process to trigger this brain mechanism and create massive transformational change for myself and my clients. And now what I do is I heal human beings. I heal physicians. I heal others to unlock that secret to helping get people over their phobias, past hurts, traumas with this biological fact called memory reconsolidation. A psychological injury that is significant enough or was significant enough that it's still touches your life today. So really anything that you think about again and again, right? Or time after time, it's affecting your well-being. Maybe a struggle, an obstacle, a problem that's still holding you back. These are what I mean by trauma. And then what we do as human beings is we create trauma responses when we go through an event. And these responses are the beliefs and the nervous system activations that help us survive the event. So if you feel like you're struggling at all in watching this with any problem or obstacle that you just can't get past, I want you to reach out and I want you to find somebody that understands what memory consolidation is. This is powerful. It can transform us as human beings in the whole realm.
Perfect. Excellent. Thank you very much for being with us today. Today, our episode on artificial intelligence and how to navigate your decision points as a patient, caregiver, and a physician. Today, our very special guest, Dr. Naga Sucharita Cheedella. She is a board-certified and renowned oncologist specializing in cancer drug development, gastrointestinal cancer specifically, and early phase clinical trials. Welcome, Dr. Cheedella. I'm so excited to have you on the Doctor Connect show.
Hi, Dr. Schaefer. How are you doing? I'm so excited too. I think this is my second episode, but I'm really, really excited to be here.
Could you elaborate on what decision paralysis is and how does it impact people?
Dr. Schaefer, as you know, it is estimated that in 2023, there will be approximately 1 new cases of cancer, unfortunately, in the United States. And it was estimated in 2022 that there are 17 million people approximately living with cancer of any site in the United States. Whenever a person has a new diagnosis or a new issue or a new problem, through my professional and personal experiences, I have seen that many undergo decision paralysis. What is decision paralysis? It is something where you have difficulty to decide. And this decision paralysis, the main impact is that the patients cannot take an appropriate decision, that's leading to delay in their treatment. And as you know, the cancer treatment is a continuous procedure, and there are many decision points throughout this cancer journey. And there are several limiting factors like emotions, first of all, and the fear of the complications, the risk, and ambiguity, and a lot of information for the patient so that they cannot make a right decision at the right time. So I advocate that, and I'm passionate in developing clinical trials and which can incorporate all these limitations so that the patient can overcome the decision paralysis and make the decision at the right time.
And you mentioned about next generation sequence. And I know we are an oncologist, obviously, we see and deal with this every day, but for the public, for the community, can you tell a little bit briefly, what does it mean?
So I was excited with the precision medicine, what is the term we used for the next generation sequencing and the way you use the technology to guide patients for the therapy. I would say that the most important moment and the promising moment in cancer treatment was the Gleevec movement, what we call it as. There was a targeted drug, imatinib, which changed the course of chronic myeloid leukemia. Previously, people used to die from CML, and we have patients now, as you know, living for many years, and it's becoming a chronic disease, then a cancer which was very dangerous and considered to be like a death sentence for many patients. So after the Gleevec movement, which came in medicine, there have been several trials going on to develop new targets for cancer therapy. I will tell my patients mostly nowadays this, it is personalized to your cancer. It is personalized to the genomics of your cancer. When we do the next generation sequencing, we identify the targets and decide which treatment is best for you, which has less side effects. And sometimes the AI technology, like molecular biosignatures, what we call it as, there have been biosignatures like Folfox AI, which we use to tell the patient whether Folfox is better in the first line or Folfiri is better in the first line, which we didn't have that information before with just clinical trials. So sometimes new technology, new methods like AI and next generation sequencing will guide us, especially the oncologist, to recommend the best treatment for our patients so that they can choose it. And this will decrease the decision paralysis.
I would like to ask you about your also contribution to upcoming book, Artificial Intelligence in Medicine. And as we both with 13 other physicians wrote the book, and you've described so many valuable tools. Can you tell us what people should be looking for in this upcoming book and learn from you? From physician standpoint and from the community, from patients and caregivers standpoint?
I think first I would talk about my standpoint as an oncologist, that I have a lot of fear about AI, even though it has a lot of potential. AI should help us to develop pathways for the progress and doesn't cause paralysis, especially the big data analysis and how do you manage the quality of the data and the output, and it should not be a black box for all of us. We should know what it is doing to the data as well as what is the result of the data. That's what I think as an oncologist I need from the AI. And for the patient, there is an ever-going question that which is the best treatment for me, and what is the life like after the cancer treatment or diagnosis, or whenever you have a problem with your decision, what does your future look like if you make certain decision? So AI can give you information to develop a pathway. If you take chemotherapy or if you take surgery or radiation or targeted therapy or immunotherapy, how your life will look like. That's the most important thing you can learn from AI.
Thank you.
Thank you.
Thank you for being with us on the Dr. Connect show. If you are interested where your passion and expertise align, go to the website, thedoctorconnect.com, and take an assessment. Remember, keep learning, stay brave, and we'll see you next time on the Dr. Connect show.